I'll start with a slide. This is a couple from the East African, which was giving us how we are doing in terms of health, which said that if you want to die, if you want an early death, try giving birth in Kenya. Okay? So we need to improve and change this situation. My presentation overview will give you a background, the current situation, will tell you why women are dying, and what we need to do to reverse the trends. Background, a lot has been done as a country, and we have fully committed ourselves as a country to ending preventable maternal deaths. We have global commitments that have been ascertained to, the UN International Conventions and Declarations, MDGs, we are part of it, UN Global Strategies for Women and Children's Health, that means Every Woman, Every Child initiative, and post-MDG Sustainable Development Goals. You know the MDGs are ending in 2015. Regional commitments, we have the Maputo Protocol, Maputo Plan of Action for Sexual and Reproductive Health. We have a campaign for accelerated reduction of maternal mortality in Africa, and the Abuja Declaration. Those I think we know. This is where our situation is as a country. You can see where we are. That's where we are as a country, and that comes into this group of 300 to 499. The 2008 census put us as 488. I think those figures we know. Among the countries on track there, you cannot see Kenya anywhere. That means we're not on track for both MDG 4 and MDG 5. What's our current status as a country? We know that 108,000 Kenyan children die before they are 5 years old. And approximately 40% of these die in the first month after birth. HIV infections, we have almost 13,000 new infections per year. That means our PTM-TCT program is not at its peak. Over 6,000 women, I think that has been told, will die of pregnancy-related complications. Why have we asked for the 15 counties? This is where the counties are, where most of the MPs and the senators have come from. Those are the 15 counties. You can see the county with the highest number of maternal deaths. Mandera leading, down to Kakamega down there. And the 10 counties with the highest maternal mortality rate. Mandera, Wajir, Turkana, Marsabit. Those are the countries that are here. I'll move on. These are the counties with the highest maternal mortality. You can see them, they've been structured, and these are the counties that are here today. These counties, this one's all that. We know causes of maternal mortality. The direct cause of maternal mortality are there with us. Still leading is bleeding after delivery, postpartum bleeding. It's still leading. We have abortion still a major cause of maternal mortality. And that's why we shall try and emphasize the need of family planning to prevent unwanted pregnancies. Then, of course, we have eclampsia and infection. Indirect causes, there they are. We start to down there, the highest cause. HIV/AIDS is the highest cause of indirect cause of maternal mortality. When do mothers die? Now we've known why they die. We ask ourselves, when do they die? As you can see, most of them die within 24 hours after delivery. Within 24 hours after delivery. During delivery, we have 25%, and 2 to 7 days after delivery. So basically, the highest time of delivery is within the first 24 hours of delivery. That's the immediate postpartum period. Let's look at deliveries. Since we initiated the free maternity services, and you can see basically facility deliveries are going up. That's why they're going up. There are these two dips, that one and that one. That's the time when the health workers go on strike. So when the health workers go on strike, services go down, and people don't come to the facilities. So I think the counties where now service delivery is have to really address the issue of a human resource for health. Let's look at financing. Who finances health for us? And you can see most of the burden, much as it's coming down, but most of the burden is coming from their pockets, households, which is very expensive. The donor, still there, still high, is increasing. but now public, we need to increase ours. We are still very low at 29% of financing at that time. What do we need to do to save more lives? One is quality care during and after childbirth. Two, ensuring that there's enough medicines, essential medicines, what we call them essential medicines for maternal health, like antibiotics and oxytocin. We ensure we have safe blood supplies. We have said most of the mothers are dying because of bleeding after delivery. So we need to have blood. And of course, we have talked about family planning services. Finally, every death that has occurred should be counted and its cause recorded and action taken. So we are, as a ministry, we have initiated in each country what we call maternal and perinatal death review and response, whereby any mother who dies, it should be an accountable event to each county and each facility. Most of the time, you'll find that most of these cases may not be actually technical issues, but you may find that there are issues outside the medical management. You may find that maybe the ambulance had an issue, there was no transport from one place. A systemic something that can actually be improved. So we want them to actually look at every death and review it. Accountability for results, that's why we are here. The parliamentarians have a key role in ensuring accountability for results. One, ensuring that women and children are the center of response and by managing the oversight mechanisms, all the things that come around the women and children. Knowing what money is being received and spent for maternal and newborn health. You need to know what money are we receiving as a country, which county, what are we receiving, and how much is being spent in child health, and of course, what results are being achieved. When we get zero maternal deaths, then we know we have achieved. But it's not just a matter of zero maternal deaths. As Dr. had said previously, there are those near misses, where people actually almost die, but they survive through some grace or the other. We need to make sure that that does not happen again. Because most of this time you'll find that you're having high levels of stillbirths, fresh stillbirths, meaning that we're not managing. The mothers may not die, but the children are dying. Supporting decisions on how policies and programs are delivered, so our surveys are based on the evidence of what works. We use the evidence of what works. Measuring what is done and using this information to improve national policies and plans of action. I'll move on. Accountability for results, that's the work for the parliamentarians, but ensuring women are at the center of the response and managing the oversight mechanism. That's our responsibility. Pregnant by choice, not by chance. How many children are there? Can you count them? You have to count them. I'll come back to it and then we count again, but there are many. Sustained investment. Why do you want to do sustained investment? It helps women and children realize their human rights. Okay? People are entitled, as per the Constitution, to the highest level, highest attainable standard of health, including reproductive health. Two, it stimulates economic growth and productivity. Maternal deaths, those who have had maternal deaths in their family or in the area, is quite expensive. And actually, globally, productivity losses of about US$ 15 billion. It's cost effective. Essential healthcare prevents illness and disability, with billions of dollars being actually saved in treatment costs. We don't want to cost and treat complications. It reduces poverty. Healthy women are more productive and earn more throughout their lives. As we quote this from Professor Mahmoud, women are not dying because of diseases we cannot treat. They are dying because societies have yet to make the decision what their lives are worth saving. So it's a matter of other things outside the health system that we need to focus on that can ensure this. We'll go a bit beyond zero, which is an excellent campaign by the First Lady, Her Excellency Margaret Kenyatta. This is what her quote is. I have decided to run to raise awareness and mobilize resources to be used for prevention of maternal and child deaths because she cares. So all of us, we need to care and use all the possible resources to her to reduce maternal mortality. There she is, handing over one of the tickets, one of the clinics, Beyond Zero mobile clinics. I know that they have gone to about for 14 counties now. That's the Kenya we want, a healthy mother and a healthy baby after delivery. So final question, do you care enough to make a difference? We should. Thank you very much.